Now, moving on to our today's session of Fetus Hour Patient. Still every day, we know that maternal mortality brings sadness, mourning to households across the land, and it is still true that it is one of the biggest challenges we have been facing.
So, to talk on the topic of maternal mortality in Suffolk region, I would like to call upon the stage the man who needs no introduction, resident of Donlad, Nepal, President of FESON, Senior Consultant Obstetrics and Gynecologist Dr. Bhola Rijal.
So now, to chair this session, I would like to call upon, all the way from India, Senior Consultant Radiologist Dr. Kuldeep Singh.
Let's give them a round of applause.
Let's give them a huge round of applause.
Namaste, ladies and gentlemen. It's my great privilege to be with you this afternoon. We are waiting our distinguished guests from India, and I think they are on the way. This program and Donlad program was started almost 10 years back in Nepal. We all know about Donlad, and especially I was not his direct student, but my teacher, Professor T. Chaudhary, was his student, and he taught us all about Donlad obstetrics. And from that day, we are very much eager to know and to learn about ultrasound technology used in practice of obstetrics. Maybe you are so much surprised to see me here with the topics of maternal mortality today, but this topic I have chosen myself just to say something about our condition in compare with the Suffolk countries. And luckily, I happen to be in India, Pakistan, Bangladesh, and Nepal. So most of the countries are our neighbors, and we know their condition also. This maternal deaths or maternal mortality is the index of any country, and we can judge the level of or the standard of the country by the number of maternal deaths in that country. So our aim is to reduce or to go for Surakshit Matritva, safe motherhood. But where do we stand? Still, it is a matter of great dispute. And our countries, neighbor countries, they have achieved their target in given time. We are trying our best since last 10 years, and our aim is to achieve that target by 2030. So let me start my small presentation. First, I will go through the maternal death or maternal mortality rate in CEFOC countries. What is the main goal of improved maternal health? Investing the better maternal health not only improves a mother's health and that of her family, but also increase the number of women in the workforce and promote the economic well-being of the communities and the country. And our Millennium Development Goal is to reduce the maternal mortality ratio by 75% to achieve universal access to the reproductive health. Some of the estimates of MDGP 5 include a 45% of reduction in the maternal mortality ratio worldwide since 1990, though most of the reduction occurred in 2000 only, that is after 20 years to after 10 years. 64% of reduction in the maternal mortality ratio in Southern Asia between 1990 and 2013, and 49% of the Sub-Saharan Africa. A 12% increase in the number of births assisted by the skilled health personnel globally in 2014 compared to the 1990, 59% to 71%. We can see maternal mortality ratio in some of the countries. They have 45% less since 1990. Maternal mortality is defined by the number of deaths in 100,000 live births. Of an estimated 500,000 maternal deaths worldwide, almost half occur in South and Southeast Asia. Maternal mortality ratio ranges from 23 per 100,000 live births in Sri Lanka to 539 in Nepal. This was a long time back. I know now our maternal mortality rate in Nepal is around 137, something like that. What is the latest maternal mortality rate? In 2020, the global maternal mortality ratio was 152 deaths per 100,000 live births, up from 151 deaths per 100,000 live births in 2019. The highest maternal mortality, South Sudan. South Sudan makes out just above Chad for world highest maternal mortality rate, that is 1,150 deaths for every 100,000 live births. This data is the latest one of 2022. 100,000 live births, up from 151 deaths per 100,000 live births in 2019. Qatar has the lowest maternal mortality rate in the world, and this is, we cannot imagine again, 1.2 deaths per 100,000. Per 100. So it comes, you can calculate it comes about 12 per 100,000 live births. So this low mortality rate can be attributed to Qatar improved health care system, renowned for its technologically advanced facilities and ability to deliver some of the world's best patient care system. So maternal mortality can be divided into 20% indirect cost and 80% direct cost. And we know, all of us, because we have been practicing obstetrics, and hemorrhage is number one, infection, eclampsia, obstetric level. So that the major cause for maternal mortality are severe bleeding, infection, high blood pressure during pregnancy, anemia, complication from delivery, and unsafe abortion. Number of maternal deaths during a given period of time per 100,000 live births during the same time period. Maternal mortality rate, number of maternal deaths in a given period per 100,000 women of reproductive age during the same time period, and adult lifetime risk of maternal death is the probability of dying from a maternal cause during a woman's reproductive lifespan. Of 2021, according to the National Demographic and Health Survey 2016, the MMR of Nepal was 2,239 deaths per 100,000 live births. Nepal is expected to limit the figure to 70 by 2030 to advance towards the Sustainable Development Goal October 2021. South Asia followed with a maternal mortality ratio of 163, or 57,000 maternal deaths a year, according to 19% of the global total. India's maternal mortality ratio has improved to 103 in 2017 and 2019, from 113 to 18. This is according to the special bulletin on MMR released by Registrar General March 14 to 2022. 7 Indian states have very high maternal mortality. These are Rajasthan, Uttar Pradesh, Madhya Pradesh, Chandigarh, Chhattisgarh, Bihar, Odisha, and Assam. Very high MMR means 120 or more maternal death per 100,000 live births. The MMR is high in Punjab, Uttarakhand, and West Bengal. 116 per 100,000 births by 2022 to meet one of the Sustainable Development Goal. The country has already missed its own 2020 target to reduce maternal mortality to 125 per 100,000 live births in February 10, 2022. The major cause of facilities are poverty, inadequate, inaccessible and unaffordable health care, low status of women and illiteracy, or in association or the public-private partnership. Only the government effort to reduce the maternal mortality, I say it is impossible. So if the public-private partnership program works even in the rural area, remote areas, then these dying mothers can be saved and we can reduce our maternal mortality. Thank you everybody for nice listening and giving me opportunity to say something in front of you.
Amazing, sir, as always. And what I loved about the whole thing was those 3 delays and the concepts that they were there. And if we are going to be looking on to that very nicely, we're going to be able to achieve our goals. That's the whole idea. The only thing is that the awareness has to be increased, which is essential. And once the patient reaches the healthcare facility, it's always and always a teamwork. So once all the things get organized, though it's easier said than done, because one needs support, and it's good to say if we're looking at in Kathmandu or if we're looking at that in New Delhi, but the moment we go towards the rural areas, as Sir rightly said, things are difficult. We cannot have the facilities, all the facilities there, but at least we can make sure that they reach the places, the right places on time. Great, sir. Thank you. Thank you so much, sir.
Thank you, everybody.
Thank you, sir. Thank you.